GEMCOVAC-OM. Okay, it is a vaccine actually. GEMCOVAC-OM. OM stands for Omicron. Okay, why is it important? Because it is the first indigenous mRNA vaccine. What is the, or which one is the first indigenous DNA vaccine? DNA vaccine. First DNA vaccine is indigenous one I'm asking about. And also in the world, it is the first one. DNA vaccine is, we are talking about our mRNA vaccine. Which one is the DNA vaccine, which we discussed already? ClearIAS D. ClearIAS D is the first DNA vaccine. Okay. Now, GEMCOVAC is the first mRNA vaccine. Okay. For the Omicron variant, has been approved under emergency use guidelines by Drug Controller General of India. Clear? As we know, it is the first indigenous mRNA vaccine for the Omicron variants of corona. Okay. It is developed by Pune-based Gennova Biopharmaceuticals Limited. That is why its name. Okay. It is developed by Pune-based Gennova Pharmaceuticals Limited. When we discussed science and technology as well, we discussed that sometimes there is a question in which the developing agency is given, right? And it will be, so you need to remember this one also. Okay. What is the advantages? It can be used for 18 years of age and older. Okay. And this one will act as a booster dose. What is the importance of booster dose? Or why booster dose is needed? Specific time, after the specific time, there is a need for rejuvenating our immunity again. That is why booster dose. Okay. Now, this could be used, as we know, it is now approved as an emergency medicine, right? So, it could be taken by anyone who has taken either dose of Covaxin or Covishield. Now, what is the disadvantage of mRNA vaccine usually? The first and the most important disadvantage is it should be stored in cold conditions. Okay. So, this, what is different from what makes it different from other vaccines is that this is a thermostable vaccine. That means it doesn't require ultra cold chain infrastructure for its storage. Other mRNA vaccines, when we discussed, the highest disadvantage was that it needs extreme cold conditions or cold infrastructure for its shelf life. But here, when we see, the difference is that it is a thermostable vaccine. This means that it doesn't need ultra cold conditions for its storage. Okay. Now, also important next thing is it can be injected as a needle using a needle-free system. That is, it is not invasive procedure. Okay. Next thing is we discussed that it could be used as a booster dose, right? So this means that it will further increase our immunity or immune responses. That is the next thing. So we were talking about GEMCOVAC. GEMCOVAC is the first indigenously made DNA vaccine. mRNA vaccine. DNA vaccine is ClearIAS D. Okay, mRNA vaccine, and it's important. It is against the Omicron variant of corona. And its importance is that it can be used in 18 years or old or plus as a booster dose. And also it can be taken by anyone who has taken the 2 doses of either Covaxin or Covishield. Next, it was developed by Pune-based pharmaceuticals. Okay. Then we discussed about the features. That is, it is a thermostable mRNA vaccine compared to other vaccines, other similar mRNA vaccines. The most important disadvantage of the mRNA vaccine is that it needed an ultra cold storage for its shelf life. But here, what does it make it different is that it can be stored even in normal conditions. That is, it doesn't need ultra cold conditions. So that delivering it to other parts of the country, making it will be easy. Okay. Then we discussed about it can be injected as a needle-free procedure, or it is not an invasive procedure. Next, it will increase the immune reactions. Okay. Now, coming to mRNA vaccine, as we know, mRNA stands for messenger RNA, right? So, what is this process? First one is first process of conversion of DNA to RNA. is transcription. RNA to protein is translation. mRNA vaccine uses messenger RNA that encodes for spike protein of the coronavirus. Okay, this is the basic thing. So, if this is a COVID virus, we said that it has some proteins in the outer surface, right? So, in coronavirus, it is known as spike. So, this mRNA vaccine will code for the spike protein which is present in the surface of the corona. Okay, and the mRNA is the spike proteins mRNA. Okay, and when it is injected or when it is given to our surface, our body, it will initiate the formation of the spike proteins, but with lesser intensity. Okay, so this will create a, what is the basis of immune reactions? Memory. Okay. Okay, this will create a memory in our body, and when the actual reaction or the actual infection occurs, there will be a higher immune reaction due to secondary response. Okay, then we also discussed about another type of self-amplifying mRNA vaccine. What is the importance? Here there will be self-amplifying genes which will further increase the amount of mRNA. Okay, what is the advantage of this vaccine? First thing is, it is a lower cost, and if it is self-amplifying design, it will make it, if at all it is given in smaller doses also, then it will increase as it is having a self-amplifying design. Clear? So we are discussing about GEMCOVAC D. It is an mRNA vaccine that is indigenously developed mRNA vaccine against Omicron. And majorly here, what it does is, it will code for the spike protein which is present in the surface of the coronavirus. Okay, it is having a mRNA which codes for the spike proteins. Okay, so first, when it is given to the body, it will first initiate a primary response, primary immune response. That means it will generate a memory. Okay. Later, when actual infection occurs, it will react or it will create a secondary response which is of higher intensity, and it will be also very faster. Okay. So this is the what we are discussing about GEMCOVAC. Clear?